This show is sponsored today by the glucagon that my daughter carries, Gvoke HypoPen. Find out more at gvokeglucagon.com/juicebox. Hello, friends, and welcome to episode 641 of the Juicebox Podcast. Today's episode is a short one. It is also the second to last in the Defining Thyroid series. Today, Jenny Smith and I are going to define Graves' disease. While you're listening, please remember that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. The Defining Thyroid series began at episode 616 with hypothyroidism and Hashimoto's thyroiditis. In episode 619, we defined pituitary and thyroid glands. In episode 624, TSH testing. Episode 628, T4 and T3. In episode 632, autoimmune. Episode 636, goiter. Episode 640, thyroiditis. Today in episode 641, we'll be defining Graves' disease, and then there's one more episode coming. That episode number is 644, and it will be all about how to take your thyroid medication. Gvoke HypoPen has no visible needle and is the first pre-mixed auto-injector of glucagon for very low blood sugar in adults and kids with diabetes, ages 2 and above. Not only is Gvoke HypoPen simple to administer, but it's simple to learn more about. All you have to do is go to gvokeglucagon.com/juicebox. Gvoke shouldn't be used in patients with insulinoma or pheochromocytoma. Visit gvokeglucagon.com/risk. Jenny, just very quickly, can we talk about Graves' disease?
Yes.
All right. Well, I have
always.
Just
ask and we'll talk about it.
Are you saying even years from now, if I send you a note and I say, Jenny, I just really want to talk about Graves' disease, you'll say, hold on, I'll call you.
Right. I'll call you.
Okay, let's get on the phone and we'll chat about it. Well, Graves is the one around thyroid that you don't hear about as much in my experience. But I have it here as Graves' disease is caused by a malfunction in the body's disease-fighting immune system. So it's autoimmune. Mm-hmm. It is unknown why this happens. The immune system normally produces antibodies designed to target a specific virus, bacterium, or other foreign substance. But as we all know, once in a while it gets weird and goes after you.
Which is so much fun when it does.
Just making my life perfect. It's an immune system disorder that results in the overproduction of thyroid hormones. That, of course, is called hyperthyroidism. Although a number of disorders may result in hyperthyroidism, Graves' disease is a common cause. Thyroid hormones affect many blood systems, so signs and symptoms of Graves' disease can be wide-ranging. So Graves' disease isn't hyperthyroidism, which is always how I had it mixed up in my head. Graves' disease is a thing that happens, and then hyperthyroidism comes from it. Am I understanding that right? Or no?
That's kind of a simplified, I guess I'm trying to digest what you just said to make sure. It's kind of like diabetes, right? Or type 1 diabetes specifically, right? I mean, it's the body's autoimmune system that is improperly doing something. And the result is a diagnosis of type 1. So the result of the immune disorder, Graves' disease is specifically the immune disorder that's named because your body overproduces thyroid hormones, right? Hyperthyroidism, essentially.
So I'm wrong about what I just said then. So Graves' disease is something that happens. It's autoimmune. And when it happens, you get hyperthyroidism. It's not like Arden got Coxsackie virus and then she got type 1 diabetes. Graves' disease is not its own separate thing.
Right.
Right. Okay.
Right. Yes, that's a good redefinition there. Yes.
I'm just trying to understand it along because, I have a very simple brain. I hear Graves' disease and I think, oh, they named it because it killed you. But I'm assuming probably some doctor that discovered it. But
right.
But that's,
Graves' disease is a common cause of hyperthyroidism, but it's not the only reason that you may have hyperthyroidism, right? Okay. Graves' disease is specifically an immune system, like an autoimmune disorder.
Okay.
One of the reasons for hyperthyroidism. So
interesting. First of all, by the way, Robert Graves, an Irish doctor who first described the condition in the 1800s, not because it put people in the grave, but I guess then all the diseases would be called Graves' disease in the 1800s, if that's how it works.
Especially those that had no treatment other than just, go to bed and put a warm blanket on your body, I guess.
Billy broke his knee. He's got Graves' disease. So, I'm going to give a couple of symptoms here of it just because it's, anxiety, irritability, a fine tremor of the hands or fingers, heat sensitivity, an increase in perspiration of warm or moist skin, weight loss despite normal eating habits, enlarged thyroid, which could be called a goiter, and a change in menstrual cycles are some common ways to know something's up. I'll tell you, those things in general, if those things are happening to you, my brain goes thyroid right away. Like just, hair falls out.
And especially if you're a woman, again, most thyroid conditions are much more prevalent in women or in females than in the male population. Not that you can't be, male and have thyroid disorder, but it is much more common in women, and especially under the age of 40 is much more common for it to, come into play. And a lot of women, especially around the time of a pregnancy, that change in hormones, especially in somebody who already has an autoimmune disorder to begin with, much more common to have the potential for thyroid disorder, both hyper and hypo around that time too.
The bulging eyes are a real common sign of Graves, right?
Mm-hmm. It was something that was one of my mom's diagnostic, along with obviously, the goiter. There's that word again, which we defined before. So go listen to goiter.
Jenny, everything was just sticking out of your mom's head and you guys thought something's wrong with mom.
Yes, we were. Well, and it was actually before my brother was born. So my brother's younger than I am. So it must've been after I was born. So
okay.
Yes.
So if you're seeing these symptoms, get to a doctor, and then in the next episode, we'll explain how to take the medication, because it's easy, but you can mistime it and really take away from its effectiveness. Right? Am I making sense here?
Yes.
All right.
Yes.
Good. Oh, hold on. See, Graves is one of those things, like, I don't know. Like there's, you know what I'm saying, right? Like you get cancer, you have cancer, you lose weight, your body dies. Like cancer makes these things happen. But I know what cancer is, right? I know that it's cells that are, that have multiplied,
that are doing the wrong thing.
The wrong thing, multiplied incorrectly. They've become diseased, etc. I understand what cancer is, but I still don't, in my heart, know what Graves' disease is.
I mean, I think it's just Graves' disease is the autoimmune hyperthyroid sort of term, right? I mean, Graves' disease, you have hyperthyroidism, but the reason it is happening is because of your immune system.
So is Graves' disease the hyperthyroidism version of Hashimoto's? And Hashimoto's is?
Correct. They're both autoimmune derived.
Right. So you can
issues.
I know at this point you're thinking like, why can't this guy get this straight? But I don't know why it doesn't roll right in my head. So hyperthyroidism, hypothyroidism. You can have hypothyroidism without Hashimoto's, but if you have Hashimoto's, that's an autoimmune disease that causes hypothyroidism. However,
yes.
However, you could have hypothyroidism without having Hashimoto's. Similarly, you could have hyperthyroidism without Graves, but if you have Graves, you're going to have hyperthyroidism.
Yes. Yes.
I think I talked myself through it finally. My God. All right. I'm going to leave this part in because my confusion has to be other people's confusion.
People's confusion. Yeah. Absolutely. Because somebody, I know family member for you wise have issues with their thyroid, but not everybody in your family with thyroid disorder has an autoimmune thyroid disorder.
Right.
Correct?
Yes.
So these are just the two main potential hypo or hyper that comes because their autoimmune system is creating the problem.
Yeah.
There are many other reasons you could have an under or overactive thyroid issue that is not from autoimmune derived problem.
Yeah. To speak about, oh my gosh, hold on. I don't know what's wrong with me lately.
Some water. Maybe it's winter, dry house.
I need hot tea. That's what I'm going to get next time. So using my family as an example, my wife has hypothyroidism. So does Arden. Neither of them are autoimmune. My son had a real crazy bout of I don't know, it was a tough year in COVID, stressful and all that stuff. And then he got Hashimoto's. As I look back on it now, we know because he did TrialNet when he was 12 that Cole doesn't have any markers for type 1 diabetes. But I bet you if he did, he would have got type 1 diabetes when this thing happened in his life. It's possible. It's
possible. But instead, just the body with the way that his body would deal with whatever environmental factor came in that turned it on.
Right. So then my kids are autoimmune sensitive, let's just call it, which is not a real thing, but probably. And that's interesting. So
yeah. Well, and the other interesting thing is that Arden's thyroid disorder is not, she has no autoimmune, she has no antibodies for thyroid, right? So if those antibodies, as we've defined kind of before, if those aren't there, then the reason for her thyroid problem is from something else. Something else is going on that's creating the havoc within her thyroid, right? Because again, antibody positive would be autoimmune related in terms of Hashimoto's. So that's very interesting for her because she has an autoimmune disorder already.
I'm going to guess inflammation. I know that's such a word that people just throw around, but I think people with autoimmune issues have inflammation in their bodies and things go wonky because of it. And that is going to be my guess.
We have to treat our guts better than we do.
We are doing that right now for Arden. Arden is taking all kinds of stuff. So I enjoy every day arguing with her about taking the supplements.
Yes, I'm sure that you do. Is she still taking, I'm curious, is she still taking, or maybe one of you was taking berberine for sensitivity?
My son was, but it stopped when we figured out those were things they were throwing at it before they realized he had Hashimoto's.
Gotcha.
So, she's just taking a couple of different probiotics, very target potent, strong probiotics, fish oil. She's getting a blood draw today actually. And then after that, her vitamin D supplementation is going to go from pill form to liquid.
The drops.
Yeah. And some other things. So hopefully I'll be able to report on that later with some success. Okay. Cool. Well, there we go. Now we're done with Graves' disease for sure.
We muddled through. Yes.
Well, that's my confusion. But I think that's what these conversations are for, to try to talk through this stuff. Because I don't know. Anyway. A huge thank you to one of today's sponsors, Gvoke Glucagon. Find out more about Gvoke HypoPen at gvokeglucagon.com/juicebox. You spell that GVOKEGLUCAGON.com/juicebox. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. And hey, if you like Jenny and you'd like to hire her, She works at integrateddiabetes.com.